Well, a warm welcome to today's talk, Tuesday the 7th of February. Now, there's a public health emergency going on in most of our countries. For example, in the United States, over 11% of the whole population is diabetic. In the UK, it's just over 7% of the whole population is diabetic. And this is associated with so many disease processes. People are much more likely to die earlier, much more likely to get heart failure, renal failure, cardiac problems like myocardial infarction. So many risks associated with this, diabetic, blindness, all sorts of problems. And the evidence is now in, as far as I can see, on the protective effects of vitamin D. It's not being done because it's dirt cheap and Big Pharma can't make any money out of it, so it's not being pushed. But I'm going to give a meta-analysis this morning that shows a 76% level of protection between higher levels of vitamin D and lower levels of vitamin D. So stick with this, because this is a really quite huge international import, and it's not just in the Western countries. This is all over the world. India's terrible for diabetes, for example. First paper I'm going to look at is this one, Annals of Internal Medicine, Diabetes and Risk for Type 2. So basically this is people with pre-diabetes, people that are going to develop diabetes in the next few years. How can we stop them developing diabetes? So references there as always. It's quite nice, this one, actually, although unacceptably this paper is paywalled. The Annals of Internal Medicine do provide a nice summary for people, well, for anyone to read, sort of plain language summary, which of course is always good. Vitamin D has many functions in the body, including a role in insulin secretion and glucose metabolism. So insulin, of course, is the hormone produced by the pancreas that lowers blood sugar levels. Now, observational studies have shown an association between low vitamin D levels and increased risk for developing diabetes. So if we look at lots of people, we find that the people with the lower vitamin D levels develop more diabetes. But of course, this is a correlation. Is it causal? And that's what this study does. It actually looks at 3 interventional studies where vitamin D was actually given and the benefit was actually observed. So this is an interventional study. It takes it from observation, which is a correlation, which may or may not be related, to actually demonstrating that no, if we do improve vitamin D levels, the amount of diabetes does go down. So it's interventional. That's why this is so important. So does giving vitamin D to people who are at risk of diabetes reduce the risk? Looked at 3 databases, data going up to the 9th of December 2022, so pretty up to date. Compared the use of vitamin D versus placebo, which of course is classic technique, classic interventional double-blind technique in adults with pre-diabetes. People that are going to develop diabetes, often described as a sort of a glucose intolerance. These people won't be diabetic now, but without intervention, they will be pretty soon. A meta-analysis of pooled data now. It's a 3-year follow-up. So that's good. And the vitamin D group, the new onset of diabetes was in 22.7% of patients. The placebo group, it was at 25%. Now, it doesn't sound like a big difference, but that translates into a 15% reduction when you look at the figures. So given the huge number of the tens of millions of people with diabetes, this is absolutely huge. 15% reduction, but it actually gets better than that. Numbers needed to treat to prevent 1 case of diabetes is 30. So this means if we give 30 people with pre-diabetes the increased amounts of vitamin D, if we give them that as a supplement, 30 people treated will prevent 1 case of diabetes. Now, that might not sound like much either, but we've been looking at data recently for the autumn boosters, for example, for the COVID mRNA vaccines, and we found that you need some cases tens of thousands, and younger, fitter people, hundreds of thousands need to be treated to prevent 1 hospitalization. So 30 as a number needed to treat is actually quite excellent, especially as the study found this to be safe, and especially as it's dirt cheap. Vitamin D can be bought from the supermarket for essentially nothing, and we could make it a lot cheaper than that and give it out if we wanted to, if the political will was there. Political will's not there, of course, because politicians seem to be interested in making money. and there's no money in vitamin D because, of course, it's out of patent. Reduced risk reduction by blood levels. So people who had at least 125 nanomoles per litre, and that's the same as greater than 50 nanograms per mil, compared to 50 to 74 nanomoles per litre. So this is the higher group with higher levels. This is the lower group with lower levels. Cholecalciferol, that's the vitamin D3, reduced the risk for diabetes by 76%, hazard ratio 0.24. 76% reduction. This is absolutely huge. 76% reduction for a simple, cheap, safe intervention. Or as much as we can use the word safe. This study certainly found it to be safe. Very few people will have difficulties taking vitamin D. Of course, I have to tell you to go to your doctor first before taking anything. Don't take anything on my recommendations. There are a few people with sarcoidosis, for example, that can't take vitamin D, but it is very rare. Most of us are deficient most of the time in winters in the northern hemisphere. 3-year absolute risk reduction of 18.1%. So this is the absolute risk reduction. This is absolutely incredible, looking at the whole population. So the 76%, this 76% reduction was for people with pre-diabetes. The absolute risk reduction for the whole population is 18.1%. This is a massive benefit. Why is this not being done? I believe it's negligent of the medical authorities not to do this, because we have an absolute epidemic, pandemics of diabetes. Now, the dose used, one study used 20,000 units of vitamin D3 a week, cholecalciferol per week, 20,000 units a week, and one study used 4,000 units a day. Now, personally, I take 4,000 units a day. That's 100, same as 100 micrograms of vitamin D. That's what I take personally, and I also take 100 micrograms of K2 with it, because the K2 sequesters the calcium released by the vitamin D and puts it into the bones and takes it out of the tissues. So that's what I'm taking personally. Can't tell you what to take, but that's what I'm taking personally, 4,000 units a day. Now, another study took 0.75 micrograms of a synthetic one, but basically these are the sort of figures that we are looking at. 4,000 units. Actually, 4,000 units a day is not that high. Of course, it should be titrated on an individual basis, but most doctors in the UK won't do vitamin D levels, unfortunately. Mine won't, unfortunately. So we're left to guess. That's why I guess that the best amount is probably 4,000 to 8,000 for me, but because I'm a bit conservative and I don't know, I just take 4,000. If I was able to get my blood levels tested, as I should be able to, but I can't, but if we could, then we could titrate that up or down a little bit. I suspect I would need to titrate it up a bit, but of course I don't know because I can't see my blood. We need tests. I think if we want to spend money effectively on a public health intervention, we should be testing the whole population for vitamin D levels. That would be a really cost-effective intervention, whereas other massive public health interventions that are going on at the moment are less cost-effective, in my view. Adverse reactions. So they look for kidney stones, high blood calcium, high calcium in the urine. They didn't find it. They didn't draw any definitive conclusions about safety because the numbers were so low. So they didn't get an increase in kidney stones. They didn't get an increase in, this is this is calcium in the blood, and they didn't get an increase in calcium in the urine, which is good. Their implications in adults with pre-diabetes: vitamin D was effective in lowering the risk for developing diabetes. The case is, in my opinion, made. Now, why is this important? Let's look at data here from the Centers for Disease Control in the States. So 1 in 5 people with diabetes don't know they have it. Let's look at the figures here. This is by the numbers, CDC. We're not great fans of the CDC, of course, but we assume they can collect diabetes numbers. This is from total diabetes from 2001 to 2020. Diabetes increased significantly amongst over 18s. At the moment, 37.3 million people have diabetes. Absolutely incredible. 11% of the US population. Absolutely incredible. Now, normally over 90% of these would be diabetes mellitus type 2. DM1, diabetes mellitus type 1, that is the normally comes on when you're younger. That's caused by a disorder of the pancreas with insulin deficiency. Whereas diabetes type 2 used to be called maturity onset, but sadly a lot of people are getting it now. And it's the diabetes type 2 that we're talking about. So 37 million people with diabetes, 28.7 people have been diagnosed, 8.5 million who have diabetes have not been diagnosed. And in this 8.5 million people in the States, they are developing pathology every day as a result of the chronic hyperglycemia. In a country like the United States, this is simply not acceptable. 8.5 million of your citizens have diabetes and don't know it. We'll see the UK is not a lot better in a minute. Total pre-diabetes, 96 million people. So we can reduce that by 18%. Well, heck, that's going to be about 50 million cases over the 3-year period. And presumably over the next 3 years, it'll be another 15 million cases prevented. The economic costs, 327 billion. This was in 2017. Absolutely incredible. For the individuals concerned, $9,601 per year. And of course, some people simply do not have this money. Massive economic costs. Now, the UK is not a lot better, a bit better, but not a lot. These are the figures from Diabetes UK. Let's look at those in a bit of detail now as well. UK prevalence of diabetes, 4.8 million. It's 7% of the population. Still quite incredible. 3.9 million diagnosed. 1 million don't know they have it. So 1 million people in this clever, sophisticated, the United Kingdom have diabetes. It's damaging their organs. It's damaging their heart vessels. It's damaging their kidneys. It's damaging their eyes. It's damaging their peripheral circulation. And they don't even know they have it because no one's bothered to look. This is quite ridiculous. We should have public health screening for blood sugar levels, and we should have public health screening for vitamin D levels. But it's lacking as far as these 1 million people are concerned. And this is so simple. You just do a finger prick to test for sugar. I mean, okay, it's better to do blood levels for HbA1c, for glycosylated hemoglobin. But it's a simple blood test. Why is this not being done? It's a real failure of primary healthcare in the UK. Don't we care about our people or something? What's going on here? Quite annoying, really. It's going to go up to 5.3 million people by 2025. People with type 2 diabetes, 50% more likely to die prematurely, 2.5 times more likely to develop heart failure. Horrible disease, heart failure. People with heart failure suffer terribly. Horrible disease. Twice as more likely to have a heart attack. That's a myocardial infarction, an MI. Twice as likely to have one of those factors. Now, Diabetes UK do stress obesity as the main factor. But of course, vitamin D deficiency is more prevalent in people that are obese because vitamin D is fat soluble. It absorbs into the fatty tissues. So when you give an obese person some vitamin D, it doesn't go into the blood, it goes into the fatty tissues. So they're way more short of vitamin D. You have to supplement them with higher doses for longer to get the vitamin D levels up in the blood. But we're eating too many sugars, we're eating too many carbohydrates, we're eating too many processed foods, we don't exercise enough, and we don't get enough vitamin D. Or correctable, but the vitamin D one is just correctable with a few tablets. Obesity is hard work. Cutting down on sugars is a bit more complicated. Carbohydrates is a bit more complicated. Processed foods are just everywhere and are cheap, unfortunately. We need to eat a lot more fruit and vegetables, especially a wide variety of plants. And more fat-containing food, as long as it's not processed fats. But the vitamin D one, it would be easy. Test the levels. Give a simple supplement, and we would eradicate that variable and presumably reduce the risk by 76%. with an absolute risk reduction for the whole population of over 18%.